Hello, everyone, and welcome all to Dr. Gregg's presentation of Advanced Biomechanics Assessments and Healing Technologies. Dr. Gregg has been running his own successful practice for almost 20 years and has successfully utilized laser technologies to help grow his business. As follow-up for his presentation at the recent Canadian Chiropractic Association National Convention, Dr. Gregg will discuss in further detail how he builds his highly successful wellness practice by offering advanced biomechanics assessments, therapeutic laser treatments for various conditions. The result, a stable, loyal client base that generates many referrals. Now, it's my pleasure to welcome Dr. James Gregg.
Well, good morning, good afternoon, good lunch hour to everybody that we have with us today. I'm very excited to be doing our webinar. Some of you may have heard me speak before, and for those that you haven't, welcome. I'm looking forward to hopefully sharing with you some of the work that we've been able to accomplish over the last 18 years that I've been in practice, and hopefully we can help you grow your practice to exciting new levels and help more people, because that's our goal. One of the things I think that qualifies me to be speaking with you today is that I am in the trenches working with you. I am a full-time chiropractor. I love being in the office. I've been in practice for just over 18 years. We've done about 185,000 office visits. We've probably performed over 2 million adjustments and hands-on procedures in the office. So I think we have a pretty good handle on what you're going to see in practice. I've been blessed to study some of the best teachings in the world. I'm an information junkie. I love to study information and pull things together, particularly for chiropractic, and to see what people outside of chiropractic are doing to help us be stronger in what we do. And I hope to share that with you today. I've done some advanced training with the Titleist Performance Institute. I did this many years ago, and it was a life changer for me. It introduced me to some concepts that people that are doing things for chiropractic, outside of chiropractic, in amazing ways. It's unfortunate that we don't own those for ourselves, because there's some great work in the biomechanics world that is showing and complementing chiropractic to greater and greater levels. And having studied that with my own unique philosophy, I'm a principled wellness-based chiropractor who has seen more and more amazing things happen in our office through the studies that we found, and I think that chiropractic's never been stronger, and we want to help you get to those levels today. So I'm going to share with you some of the information and the knowledge that we've come up with. The title of our talk is Becoming a Go-To Chiropractor. To be the go-to person in your community, the go-to doctor that your patients choose, the go-to doctor that they'll pick up the phone the minute they think of something, that they're not going to leave your office to get care for other conditions outside your office. They're going to turn to you first, and then you can take care of them accordingly. If we look at today's lifestyle, biomechanically, we've slid down the chain. This is a great picture that shows the evolution of how we stand, the work we do, and where we end up sitting. Today's epidemic, if you look at the mobile phone. My kids, many kids, teenagers, students, everybody working at a desk, sitting at a computer, head down, texting on a phone, nonstop. We are creating an epidemic of biomechanical instability in spines, and we are seeing it show up today in the previous generations that did more hard work and hands-on work. We're seeing bodies break down, and the chiropractic profession needs to be ready to be willing and able to handle all the things that are coming their way because of these breakdowns. But the most important thing is predicting what's going to break down, the patterns that our lifestyles are creating, and be able to accommodate them. What do your patients want? Patients want, this is the most important question, because chiropractic has many philosophies within it. The old philosophy of the body heals itself from above down and inside out is more relevant today than ever. It's the main premises. But we venture off when we get into insurance-based guidelines, we get into pain, we get into evidence-based versus clinician-based versus putting them together and whatnot. But we often forget, what does a patient want? They're the ones who are coming to us. And they're the ones that talk with their feet. They're coming into your office or they're leaving your office. They're choosing to go get physiotherapy or massage therapy or chiropractic care or acupuncture. They're using their own dollars and their own choices for what they think is going to make sense to them. And it's up to the chiropractor or the practitioner using the services available to them to engage them in that conversation. So what do patients want? Patients want affordable care. This is going to be a theme I touch on as we go along in the form of this. And I'm gonna enlighten it to begin with, and please keep this in the back of your minds as we go along. if patients can't afford to get your care at the frequency and the number of visits required to heal, they're not going to see the results that they need to have the wow factor. When they can afford your care, to get the long-term number of visits over weeks and months to heal, getting in the routine of coming to your office to see you, choosing you, building trust with you, and seeing the results, they are the ones that are going to refer patients to your office. They are the ones, you don't need a Yellow Pages ad, you don't need a spinal care class, you need results. And patients are going to refer people if they can get into the routine of coming to you, can afford to get your care, and get there long enough to see the results. Those are the magic patients that refer everybody they know. Patients want to be examined and listened to. We know our healthcare crisis in Canada. Yes, we have universal healthcare. No, we don't have universal access. 5 minutes, there's a note on family doctors' offices that you get to discuss one complaint. One complaint when you show up. You get 5 minutes, and we know that usually that means some kind of a prescription to make the symptom disappear at the time. Patients don't want that, but they don't have a lot of choices, or they may not know they have those. Flexible appointment times and easy access to a table. That's something that we pride ourselves in our office. We have an open door policy that says that if you want to be adjusted, you can come in and get out of our office. If we're in the office adjusting, you can call and get in. And I'm going to explain a little bit more about how we're able to do that as we go along. Patients want hands-on care. They want to be adjusted. They want to be worked on. They want the doctor's hands on them, not just assistants and other people. So some offices have setups where they have a lot of different people. They have kinesiology, they have massage therapy, they've got all these great things. But as the doctor, please don't forget, you often have to get your hands on them as part of that team. Patients want drug-free ways to be pain-free and able to move. Lack of mobility is the key destroyer of lifestyles in today's society. Would anybody agree with that? Yes or yes? Patients also want high tech. They want the latest healing technologies. They want the cool thing. People want some things that's going to show that they're doing results, and they want to be on the cutting edge of this therapies. The beauty is today you're taking a seminar for a company that is progressive in all of those things, and a company that I started using 10 years ago. The reason I'm speaking to you today is not because I applied to come to them to be some speaker. They came to me and said, how are you seeing so many people? How are you helping so many people? We want to help more people do this and share as we go along, and that's why we're here today. So let's remember that as we go along. So what is a go-to chiropractor? A go-to chiropractor is someone who patients turn to first for their health and well-being for all their concerns. A typical patient in my office is under regular chiropractic care. They may have started for an original complaint like headaches, like disc, like sciatica, piriformis, tension, whatever the issue is, asthma, breathing difficulties, immune system problems. They come in with a problem. They begin a program of care to where we get them to the point of well-being. Then we encourage them and teach them the necessary steps that they can stay well through regular chiropractic adjustments, typically weekly in our office, so biomechanically we can keep an eye on them, independent of symptoms, which I'll show you tests that will do that, that justify your need for care and that gives them the wow factor. But let's say a patient at my office has been coming in for regular chiropractic care, and they've had knee problems their whole life before I got to them. And now they've got a diagnosis of chronic knee arthritis. Quite often that patient is going to leave my office and seek out injections, some physiotherapy, some different things to work on their legs. Often we don't hear about that until they say, I can't make my appointment this week because I am getting my physio treatments. Well, what if we have the modalities that are superior to those things, the biomechanics that we can teach them how to heal and provide that care for them all in one stop, where they use their valuable healthcare dollars in a win-win situation with us. That's what they want from a go-to chiropractor. Somebody that has a rotator cuff problem that leaves your office and that isn't getting their thoracic spine adjusted has no chance of healing the rotator cuff. They need to be adjusted, and if you could provide the ancillary care to help the rotator cuff while adjusting the spine and providing amazing chiropractic principle care, they're getting the best of both worlds. It's a win-win across the board. A go-to chiropractor has a high patient retention, stimulates tons of referrals, and has a fun, vibrant, inspired office. Patients love to send their friends, family, and coworkers in. If you're not generating referrals, you're either A, not asking, B, not providing care that they will think to refer on their own. One of the things we have on the door that everybody sees on the way out of every visit is just an 8x11 sheet of paper that says this: we are grateful for and never too busy for your referrals. You are the backbone of our office, and we thank you for telling other people about what we do here. That's what they see every single visit they leave our office. What do they leave the office with? Thinking about referrals, and if they're happy, they do. And if they're not sending referrals and I'm not generating referrals, then I know I'm not doing my job the way I should be, and I have to look at that. And the last thing, a go-to chiropractor provides cutting-edge, world-class advanced care. The chiropractor who can go through an analysis system and find subluxations in the spine, biomechanical pattern indifferences, stability problems, tension problems, pull it all together and put them on a program of care that gets results, not just covers things up. And that advanced care can include things like laser therapy, that is a world-class high-tech care that people seek, that they can get results. And I'll explain how that can be integrated into your practice later. Our job is to get people healthy and mobile so they can get moving. Dysfunction biomechanically is because of the lack of motion. The lack of motion leads to the body breaking down. We agree on those principles. We don't need to go too deep into that, but we know that's a problem. There's a picture of the guy in the middle there swinging a golf club. That's me on the warm-up range at the Canadian Mid-Amateur Golf Championships this past fall in Nova Scotia. I happen to play a lot of golf, hence my interest in biomechanics and my interest in studying with the Titleist Performance Institute in the advanced biomechanics. So a lot of the stuff we come up with is from self-inflicted problems, but also understanding how to protect spines as we go. Why sitting is the new smoking? Sitting is destroying our lifestyle. We showed the picture at the front of the evolution of man and then sitting in front of a computer screen. The most important thing to get here is that we have people that spend more hours sitting than they do moving at all. They get 10 unbroken hours sitting a day. And if they estimate that we can reduce healthcare costs by $2.6 billion just by getting people moving. Canadians spend more on more time sitting and get insufficient activity for the recipe for promotion of hypertension, diabetes, and premature mortality. That's an important consideration, that the lack of mobility is creating more morbidity. Alan Goh, associate professor at Edinburgh's Harrowat University, he's a team investigating memory loss, tells me that even the simple act of walking can lead to brain functions improving. Tests on people in their 70s suggest those who had exercise had less brain shrinkage. And here's the kicker. Those who did a bit more exercise were better in terms of their speed and thinking and general reasoning. A bit, not none, even just a little bit improves brain function. And that is where getting people up and moving is important. We're going to talk about neuroplasticity, how the brain learns and unlearns pain, how the brain learns and unlearns pain patterns, how the brain learns and unlearns biomechanical issues and not moving properly. And these are the patterns that are stopping people from moving properly. And that's what we're going to have to do to stimulate them to get them well. And we'll get into that as we go along. If our greatest athletes, the ones making $20 million a year to play a sport, are using chiropractic care, the general population needs it more. People with strong muscles and healthy tissue tone getting worked on by trainers and stretching every day, and they still break down and need our care, we need to get it too. Tom Brady, he's the best in the league right now. Chiropractic makes me feel so much better. When I walk out of the clinic, I feel I'm about 3 inches taller. Usain Bolt, the fastest man on the planet, he needs it more than anybody. And of course, Tiger Woods, on his stretch when he was the greatest golfer of all time, he definitely was under regular chiropractic care. And this year's Masters champion, Jordan Spieth, he got up on stage when he won the Masters and said, "I'd like to thank my chiropractor." That's the first thing he said. That is an amazing compliment to us. And that's where the world is looking at us now and where to take our rightful place. So the main concept we want to talk about when we're getting into being a go-to chiropractor is understanding pain inhibition. This is where the chiropractic profession can make its greatest inroads. The concept, some chiropractors, the principal chiropractors, yes, we have pain, but we also do great work on health. Then there's the far extreme of evidence base where if it doesn't have pain, we shouldn't touch them. Well, in the middle is where the truth lies, but you have to have the philosophy of well-being at the forefront. Evidence-based chiropractic without the clinician's judgment has no validity. So if we want to get further down into studying and understanding the advanced biomechanics that lead to health and well-being, we have to understand pain inhibition. Pain inhibition is basically when pain or the avoidance of pain causes abnormal function of mobility, stability, and function. Now, this can consist of reversible, misdirected nerve communication from the cerebellum, cortex, limbic, and vestibular centers. That's called dyskinesis. That's a reversible pathophysiologic state consisting of misdirected nervous system output. We can change those patterns, reversible, that's the key word. Pain inhibition is what you see in your office presenting as guarding, antalgia, and difficulty performing basic motions like rolling over in bed or even on your tables, checking the blind spot, raising your arm even halfway, or my favorite this week 3 times, getting their socks on. They can't even get their leg up to put their socks on. Now this is a little video that I've got. Hopefully it's going to work. So let's see what we got here. This is going to be about how pain inhibition starts in the body. What happens is that we have signals traveling up and down the spinal cord, and by whatever disruption, subluxation of the spine that leads to weakening, or a nerve root impingement within the disc or in the nerve root area, fires off the pain nerves, releasing massive amounts of substance P. Now this massive substance P reaction is our pain fibers traveling in. The spinal cord sends a signal up through the thalamus, the presynaptic integrated pool, to the cortex, and all the areas of the brain that can get affected are being lit up here. Now this is from the Neuroplasticity Study Center in Toronto, and this is quite amazing. Again, outside of chiropractic, what they're showing is that what we see when chronic pain develops. So when this video goes for a minute or so here, so just please stay with me as I try to help and watch it run its course, because when you understand what's happening in the brain, the neurons that are firing, you have to understand the feedback systems and why chiropractic is important. So the brain is constantly making brain bridges. This is called neuroplasticity, the ability of the brain to build. And that excitability makes more brain maps and representation. So you see neurons in the brain perceiving pain, altering motor function. Altering motor function causes antalgia or guarding or limping or moving out of the way, some of which can have pain or blockages in other areas, some of which may not have pain. When the neurons get excited, then they're firing off. If they're firing off for too long, when they become a pattern, that's where people have bad results in their healing, because we don't address the pattern. And medications can't change chronic pain. So it's inhibited from functioning properly. This pain inhibition is crucial to understanding the concept of where people start off in our offices and prevention of that. So to unlearn pain, you have to see a system where you break those patterns. So let's go to inflammation and chronic pain patterns. This is just another short video. Stay with me, because if you understand this video, you will know where we go everywhere here. This is the interstitial fluid in the fascia and the fibrous tissues that make up the neuromusculoskeletal systems in the body. This process is pretty amazing. What happens in this area is that when you have an injury, or you have a chronic repetitive strain, or postural imbalance that does not produce pain, like sitting at a desk for long periods of time, with or without pain, if you start this inflammatory or damaged cycle, this is the video I thought was going to maybe just give us a bit of a grief issue here. Just going to see if we can get it to come to fruition here. Stay with me here if we can, guys, and I'll try to make this work better. So you can see the interstitial fluids, you can see the connective tissues, you can see the blood supply, you can see the nerves, and you can see the collagen tissues all running through this matrix. The little green circles you see are fibroblasts, the tissues that are responsible for engaging the chemical communicators and producing and healing tissues and cells. You have macrophages that are running around the immune system cells. When you have chronic inflammation in the body, as we know, swelling and interstitial fluids expand and they branch out, and then they cause direct pressure, and thereby it's not moving properly. So for instance, think of a muscle that's not gliding properly. So now you see nerve signals traveling. Let's say there's an injury state or a strain or a chronic inflammation. When injury begins, fibroblast transformation, now chemical communicators start. So it's transforming and it starts moving, and it's migrating to the source and to the site of where we have these irritations. Again, this can be with or without symptoms. So this is really important, because you can have no symptoms or no pain or no problems and still need help. So when those chemical communicators are going on and then listing, What happens is that fibroblasts cause inflammation in and around the nervous system, in the fascial interstitial fluids, and around the nerve. And those nerves will then release those neurotransmitters that cause that substance P release we saw in the previous video. Macrophages, which is the inflammatory cells, like say you sprain your ankle and all of a sudden you've got a great big puffy patch right in the bottom of your foot that's causing that, and it doesn't go away, it gets hard afterwards. You ever seen anybody with a severe sprain and then their skin dries afterwards? So now we've got, when inflammation is resolved on the left, the inflammation then settles, and if you break that cycle, normal tissue happens. But if the inflammation isn't resolved, as you can see on the right, you start that process of the nervous system firing off. So when the fibroblasts return to their normal functioning form, they just make collagen and they heal the tissues and they go back to your normal matrix. When they do not return to their normal because the nervous system is inhibited from firing the proper neurons, you've got the inflammatory cytokines that are coming into the tissues, and the cascade of inflammation, dysfunction, and non-healing and inhibition start. Now this video runs a little bit longer, but you get the basics, I hope, from that. So neuroplasticity is essentially when we've got the nervous system that is growing and representing a pain pattern in the brain that is bigger. So Norman Doidge wrote a book, The Brain's Way of Healing. He is a neuroplasticity expert. He's not a chiropractor, not a medical doctor or physio. He studies neuroscience. And he basically says this, is that when, in the middle bullet there, the brain is plastic. When it is stimulated in an ongoing way, say by a pinched nerve, aka chiropractic, the subluxation, the concept, the pain map for the hurt area grows in size. And it becomes better at processing pain. Alas, chronic pain is plasticity gone wild. We have a chronic pain epidemic. We know that morphine and oxycodone and all the larger drugs that people use for pain actually produce compounds when they're digested that block nitric oxide receptors, and that is part of decreasing inflammation. So if the byproducts to relieve pain is blocking the ability to get rid of inflammation, you need stronger and stronger drugs to override that. Hence addictiveness. Hence narcotics that are becoming greater and greater doses and lose their effectiveness as they go along. Now a little blur in the middle, superpulsed laser literally causes nitric oxide to be released and help decrease inflammation without drugs and toxic byproducts. So having laser therapy, and only the superpulsed kind of laser, I should be very clear on that, can activate the pathway to do that. And that's an important thing to understand, the technology that certain lasers can't activate that pathway. Theralase laser is a superpulsed laser that happens to do that. Now Dan Murphy is a neuroscience teacher at Life West University, and has been studying and presenting to the American whiplash conferences for forever and ever and ever. And his information and the science behind it is an entire whiplash volume that's 95 pages long. It's pretty amazing, but here's a couple of the main key points that we really need to know. A stiff or fibrotic spine decreases mechanoreceptor firing to the cerebellum, the thalamus, and the hypothalamus in the brain, affecting the sympathetic nervous system, your physiology, and hormone production. A stiff or fibrotic spine. So you can have stiffness but not pain. Stiffness will shut down the proper pathways of the brain, creating pain inhibition. You have to get adjusted. You have to keep that spine freely moving, pain symptoms or without symptoms. And that's kind of important for chiropractors to understand. Now, gravity. Gravity influences your physiology. The more the head shifts forward, now let's go back to the person sitting at a computer screen, texting all day, leaning forward, the anterior gravity line, the spine collapses, the faster you die. The biggest single predictor of early death was head shift forward of the normal gravity line. And the farther forward, the greater the consequences. Again, the important message take home, getting adjusted for proper stability and support of the spine. Then the last one, changes in the spine can change the expression of our genes. Catecholamines and other epigenetic methylation, shorter telomeres, shorten your length of life. Frequent chiropractic care resolves inflammation, fibrosis of the spine, changes in mechanoreceptor firing, affecting sympathetics and improving immunity. Now, laser therapy helps decrease pain, lower inflammation, stimulate cell healing. You couple that with hands-on chiropractic care, which depolarizes every neuron in the body when you adjust the joints of the spine. You are creating a representation in the brain that allows for wellness to destroy pain patterns and restore health patterns. So the 10 circles of neurology are really important here. And I don't have the time in this seminar to get into it, but basically this. I showed you on the little video with the spine showing the pain pattern going up from the pinched nerve. If you look in the bottom left corner, the sympathetic chain ganglion goes into the spine. The lateral coracospinal spinal tract goes to the thalamus. The thalamus is the presynaptic integrative pool to the cortex. That is where everything gets revolved around. But every time that gets fired, the cerebellum, when the mechanoreceptors fire, Dr. Murphy said the mechanoreceptors don't fire in a stiff or fibrotic spine, the vestibular nucleus of the brainstem gets affected. And if you see further down, this is where we have visceral responses to chiropractic care, which is pretty awesome. And this is a whole talk in and of itself. But the bottom line is this. Every single chiropractic adjustment ever fires the vestibular nucleus of the brain. And on the right column, upper cervical mechanoreceptors from chiropractic upper cervical adjustments fire those nucleus centers of the brain that allow the body to begin to heal itself. Journal of Neuroscience, August 1st, 2007. With or without symptoms. So the concept in chiropractic of the vertebral subluxation complex, I believe, should be evolving. And I believe that a new understanding of chiropractic, yes, there's the old theory of the bone on a nerve. Well, guess what? Any distortion of the biomechanics of the spine that can lead to inflammation in and around the nerve root, bulging of the disc, fascial restrictions due to the body's antalgia or protecting, the tissue tension that goes with it, and the lack of mobility is the new subluxation complex. And in chiropractic, if we evolve, there's no reason we can't keep chiropractic subluxation and advance it and evolve with the amazing biomechanics work that's coming out of the work with people like Gregg. And we'll get into that as we go along. So the advanced biomechanics of the vertebral subluxation complex could be this. Now, these are your differential diagnoses and the subsets of a vertebral subluxation complex. This is where you can put these in your notes, report and communicate your diagnoses, making sure everything's documented and supported. This gives you the mechanisms by which you can adjust and understand why it's important to adjust with or without symptoms. Testing patients for these different subsets of stability, mobility, and tension elasticity will leave them feeling like they were really examined and that you really paid attention and makes you the DC they trust and want to refer to. So doing advanced testing that gets into this is how you become a go-to chiropractor. So there's a couple of concepts here. Stability, motor control. Several examples of stability motor control disorder. Motor control dysfunction, meaning they don't have proper muscle communication or they can't generate the strong muscle contraction due to lack of nerve supply. Local dysfunction or asymmetry, prime mover or global muscle compensation behavior. That's like something like a glute muscle that's not firing, or a shoulder muscle that you have the lock and lift when you have a partial tear of the supraspinatus. Poor dynamic stability, alignment, postural control, asymmetry, and structural integrity. Those are your basic chiropractic checks when you're looking at asymmetries. You do the lines from the front, from the side, low shoulder on one side, low hip on the right, kyphosis versus lordosis. And then you get your potential TED, tension extensibility disorders. So insufficient muscle tone, fascial restrictions in tension, muscle shortening, hypertrophy, trigger point scarring, fibrosis. And then the JMDs, the joint mobility disorders, the joint dysfunctions, osteoarthritis, single joint spasms, fusions, subluxations, adhesive capsulitis, which is huge, remember that when we get into the shoulder, and dislocations. So how do we deliver care looking for these aspects of subluxations and on their own? How do you become the go-to chiropractor? A world-class exam that wows your patients and leads them to greater success. Affordable care, so they can get in to see you, the number of visits to change that. Fees, how to price your patients into the market, into your office instead of out to, and a schedule that sets up the office to accommodate patients and to have them preset times for amazing care. They can get to be a new patient separately and then regular adjustment times. So let's move forward and start looking into this, becoming a go-to chiropractor, applying world-class technology and doing world-class assessments. The X factor. This is where the chiropractor, the go-to chiropractor gets it. Is it stability, mobility, or tension, or is it all three? I tell my patients, I just had 2 new patients yesterday, and with both of them, they came in with chronic patterns. of dysfunction. And happened to be the one guy is a landscaper who used to be doing all the heavy lifting of the stones and moving around until he says his back was so bad, he's been through 5 mattresses, spending $2,000 a mattress. I wish I was a mattress salesperson at the time. And literally his body's deteriorated. He's a young guy, but he loves golf. So now he's playing golf in pain, creating more problems. And I look at him, and he started his own landscaping company, so he didn't have to do the heavy lifting. Pretty smart choice, but he hasn't got rid of the problems. I said to him, I'm a pattern changer. We need to find the patterns that you created 8 years ago that are not allowing you to even be able to lie in your bed and get comfortable. That's really important. He can't lie in his bed because his body can't even support lying there before the joints of the spine are rubbing and creating a dysfunctional pattern and chronic pain the brain keeps producing. So the X factor is basically this. When you're examining a patient and you want to truly understand advanced biomechanics, everything works in an X. Now, when you pay close attention to these and you can do an examination while going through this and explain to the patients what you're finding, they go, wow, this person knows that I know that they know that they know what they're talking about, and I know it. We know that the fascia contains nerve and blood supplies. We showed that in the video, but it has fibroblasts and mechanoreceptors that communicate. Fascial communication occurs body-wide and includes proprioception, nociception, interoception. This is old Janda work. So if we look at the X and the crossed lines in the body, this is where you have stable joints and mobile joints. And if a mobile joint becomes a stable joint, something else has to become mobile. And if you have a stable joint that's unstable, it will lock up and something else has to go. And this is where your patterns of wear and tear and breakdown happen over time. So this is where we want to start to look. Studying pain inhibition is just what I described. If something breaks down on one side, if a mobile spot becomes immobile or a stable spot becomes unstable, you will have compensation. This is where full spine chiropractic care is amazing. We know that biomechanically, somebody who develops a rotator cuff problem, let's say in the left shoulder, they get adhesive capsulitis, they've got a small tear, and they got an impingement syndrome, they start to guard. The scapula stops gliding around the thoracic spine. It becomes locked up. The thoracic spine is important for mobility. The corresponding right sacroiliac joint will become inflamed and locked up and lose its ability to be a stable post, thereby inhibiting the glutes. And if the inhibiting glutes on that side, all from a shoulder injury, stop firing, the hip flexors tighten. And if they work at a desk all day and their shoulders are rounding and their hip flexors are tightening, they start to stand up and they're the person who can't check their blind spot, or a mother who reaches into the back seat of the car to hand their kids something and they feel the pop or they get the spasm and they're locked up. Pain inhibition patterns or layer syndromes is a combination of upper cross syndromes and lower cross syndromes. These are basically characterized by too tight in the front, too weak in the back. I'm going to go through some basic chiropractic problems that 90% of your chiropractic patients will present with. And if you understand these and you use this approach in the X factor way, you will be able to get results with most of your patients across the board. They will definitely be displaying these things. So lower cross syndrome, or lumbopelvic vertebral subluxation complex, I call it. What happens is this: somebody who sits at a desk all day long has tightening of the hip flexors. If the hip flexors are tightening, then the corresponding glute muscles, which are prime movers, have to stop firing properly. And they are the ones that support the spine in an upright position. It's because they can't both go or they'll compress the lower discs. So symptoms of this include increased curve of the low back, forward tilt of the pelvis, weak abdominal and glutes, tight hip flexors, and hamstrings. These are the ones that they can't touch their toes, even though they're sitting all day long. But the reality is the hamstrings, they go, oh yeah, I got to stretch my hamstrings. The hamstrings are spasming to protect the spine. The hamstrings don't attach to the spine. They attach to the pelvis. So why is it guarding and inhibiting proper function? Because the prime stabilizers and the prime movers aren't working in harmony. Upper crossed. These are your people where they get impingement syndromes. The shoulders are rounding forward. When the shoulders round forward, the pecs get tight. The bursa and the tendons underneath the acromion process get impinged, creating chronic inflammation, and like somebody starting a fire with 2 sticks, start to rub, where you get that chronic wear and tear on the rotator cuff tendons. These are my favorites. I get people come into my office all the time with frozen shoulder. They've been through months and months and months of physiotherapy. They had injections, and they've been told they have to go for surgery. And all they did was be given weights and told to do weights. to strengthen the shoulder because the shoulders are too weak. Meanwhile, the shoulder's weak because it's inhibited. When you strengthen injuries in the world-class athlete world now, nobody gives anybody a weight until they have full range of motion because you strengthen the injury. So what happens is that when you have an upper cross syndrome and you have impingements, the body will not respond, it'll block. And the scapula stops moving, it doesn't have its normal tone. Thereby the neck now has to jut its chin out, creating impingement in the neck structures, leading to more headaches. And these are the people whose shoulders shut down. Simply by doing some shoulder scapular mobilizations will free up the T1 nerve root, the first rib, loosen the pecs by default, and adjusting the thoracic spine will reset the mechanism. Problem is, after 24 hours, that pattern returns, so the need for care becomes 3 times a week, every other day, every 24 hours to break the cycle for a period of 4 to 6 weeks. That's important to tell your patients with confidence and certainty that I can change this pattern, but you need time to break this. The lack of doing this is going to lead to more impingement, but we can get results. These are the people that hum and haw and go, oh, is it going to take that much care? And they said, well, who referred you? Well, Diane referred me. She had the same thing. I said, how'd she do? She's doing great. Then let's get started. So how do we test for these common conditions? Outside of chiropractic, Gregg developed the selective functional movement assessment. Gregg has been working with Gregg Rose, a chiropractor at the Theralase Performance Institute. They've been working with elite athletes. This is what, in my opinion, chiropractic colleges should be teaching from the ground up. It is amazing. They're doing our work for us, and I find it incredibly insightful. For those of you that have not seen or heard the selective functional movement assessment, it's a basic biomechanics pattern assessment. When you add chiropractic checks with the selective functional movement assessment, you've got so much information, it's amazing. So you take these people through these motions and you categorize the motions with your assistant when you're writing them down as, can they do the motion fully without pain? That's an FP or a functional, or sorry, FN, functional normal. Can they do it fully but with pain? That's functional painful. Can they do it can they not do it because of pain? That's a dysfunctional painful. Can they turn without pain but they can't go through the whole motion? That's a dysfunctional non-painful. And these are the basic categories. So essentially we have the patient stand in front of us and I go, okay, touch your chin to your chest. Do you feel anything with that? Chin to the sky. Turn your head to the left, touch your chin to your collarbone, turn your head to the right, touch your chin to your collarbone. This will show you cervical ranges of motion and tell you where it's breaking down. Upper extremity. Can they touch their shoulder blade? Can they get their arm up above their head? You'll immediately see if they've got any restrictions in the shoulder, if they're upper cross or lower cross. External rotation or internal rotation will predict impingement syndromes in the shoulders. Multi-segmental flexion, when you lean over and touch your toes. They can't, this is where they go, my hamstrings are too tight. I go, okay, let's pick one foot up. And they stand on one foot with the other one just on their toe, and often they can go down. Why? We've unloaded the spine. You're taking the pressure off the joint. They can do it. And so I'll say, see, it's not your hip flexors that tight. Very often, and now there's multiple layers to this. This is just the basic tests, just by the way. Multi-segmental extension, I go, put your arms back, make a big banana. If they can't clear and they make a big rounding curve, you can see if they have an extension issue. Again, dysfunction or inhibited. Rotation, can they turn and look backwards? Can their hips clear, or do they turn their upper torso and leave their hips locked? This is your low back pain, sciatic patients, glute pain, glute fascia tightness people that can't turn. They will turn, their hips will stay facing forward, and they'll turn their upper body and they'll lean to one side. You can do the signal leg stance just to see if they have any balance or coordination, and then the squatting pattern. The bottom one, the overhead deep squat, is the most important predictor of full motion. Now, some of your seniors aren't going to be able to do this, but you're going to ask them just to see what they can do, because this is a good starting point. And they're going to learn what they can and can't do as you go along. Once you start working on them for a few weeks and you retest this and you go, remember you couldn't move your arm through this range of motion, or you couldn't even turn this far, look how far you're turning now. They go, that's my go-to guy. That's my go-to girl. You got to see my go-to person. Look how much more motion they've got for me. So here's a typical example. Can you see the abnormal patterns? This person's doing the overhead deep squat. They got a low left shoulder because they can't retract the shoulder blade to get into position. The right knee is kicking in. Remember I said left side, right side, that makes the X. They're leaning forward because they can't get their spine straight. They have an excessive lordosis, and the knees are out in front of the toes. That is a stability problem with the core not holding them up. That is a joint mobility problem with the left shoulder, and that is tension elasticity, because the body will not allow the thoracic spine to carry the load and rotate backwards as the body drops down and in. These are simple little tests. You can pick them up really easy. So when patients see that you know what you're doing there, and then you show them, hey, I'll bring them their arms down in the overhead deep squat, and I'll say, okay, now do it. And they'll go, oh my God, that's easier. And I go, yeah, because I've unloaded the spine, so you can't handle the load of the spine. That's why this isn't getting any better, and that's why we need to get this moving freely. So those are a couple of examples that are going on there. So upper cross syndrome, lower cross syndrome are your upper and your lower patterns that people present to your office. And if you take them through a functional movement screening like that, they're going to go, wow, this person's the first person that's ever really examined me. And then when you get into some of the fixes, they can do this even better. So treatment, chiropractic care. We know every adjustment fires the vestibular nucleus, thereby we can change patterns. Active release to loosen up stiffer fibrotic tissue. Remember Dan Murphy said the cause of deterioration is a stiffer fibrotic spine. Laser therapy. Laser therapy stimulates the blood vessels to restore normal circulation, decrease inflammation, bringing nutrients into the joint. The nerve cells, because of the lipid absorption pathway, absorb the light and decrease pain, thereby stops the blocking of normal function, so you can get in there and get their bodies moving, and you can do your work. And if you do 3 minutes of hands-on chiropractic work and 6 to 9 minutes of laser on a sore or damaged part, that's all the time you need. The brain cannot process any more information. Your chiropractic visits should be 3 minutes with you, and should be 6 to 9 minutes in a restful period of time with the laser, and watch them generate amazing results, doing that at a frequency that's going to allow their patterns to change at a reasonable price that allows them to come in that often. So chiropractic work restores the connective tissues, the joints, and the fascia, allows the cells to absorb the laser, because when you get in, you open up the joints, you do active release, you separate the tissue, start adjusting the joints, restore some mobility. Now laser can be absorbed by the body to help speed up the process. I like to tell my patients that the world-class chiropractic care you're getting is allowing us to get the joints and everything moving, and then that allowing the laser to come into your cells and putting your healing processes on Red Bull. It's giving you wings. And they go, yeah, I want wings. I want the laser. This thing's really cool. So we know it can speed up their healing time, and a lot of patients will get an adjustment, an active release. I'll take them through some of the biomechanical fixes. We'll laser them for 3 to 9 minutes. They'll get up and they'll go, I feel a bit better. The next time they come in, I go, how did that go? And they go, you know what? It lasted for about 24 hours, just like you said. But then it started to come back. I go, then we get on that. 2 weeks later, I go, how does that go? You know what? Patterns changing. I don't see it. It's lasting longer. I'm feeling better. I'm getting there. I still have a little bit of stiffness. Well, we're still adjusting you. Then you get down to 3 times a week for 4 weeks, and you're like, you know what? We're getting to the point where if we get a couple more weeks of this and you're holding your patterns, I want to see you less. I want to put time between our visits, beginning of the week and the end of the week, instead of 3 times, to push the time, because you're getting there. They want to get to that point. They want to prove to you that they can go that long, but they're keeping their schedule to get to that point. It's really cool. If every adjustment fires the brain and lasers absorbed at the site, affecting neurotransmitters, and it's blocking pain patterns, then the lack of giving chiropractic care and doing laser therapy to help that will encourage deterioration. So it's important to give chiropractic care with or without symptoms, because a stiffer fibrotic spine starts earlier. It's a predictor of death. Anterior head carriage must be stopped. Is it not negligence to not get your hands on patients, to biomechanically assess them, and if you see a dysfunctional pattern, to restore it at that moment in time so it doesn't progress? Yes or yes? And if patients come into your office and they're perfectly clear on all levels, they pay you an appropriate fee for your time, for your talent, for the process of assessing them. But very often people are going to come in with some form or another of some pattern, with or without symptoms, because that's the way we sit at our desks. That's the jobs we do in today's society. Now here's another thing. Patients come in with chronic arthritis in their knees and shoulders and the spine. Maybe they're the people that came to you way after they had these problems. What do? Chiropractically, we're going to get our hands on our spine, but biomechanically, they're going to have altered functions. They're going to be compressed. They're going to have issues. These are the patients that will be going to physiotherapy offices. They're the ones that will go for 6 months trying to get some pain relief. You've got their spines working great, but their knee is still full of bone spurs and arthritis. Well, in my office, they come in for their weekly adjustment, but we have patients that come in 2 extra times a week for a laser-only visit to keep the inflammation down, and I put them on an icing program. So they'll come once a week for adjustment with laser. They'll come twice a week for 2 laser visits on their knees just to keep the process going, or on their shoulder, or on their plantar fascia, or on the carpal tunnel they've got, or the tennis elbow. So they're getting regular chiropractic care, but I'm the go-to office. They're coming and using their healthcare dollars to get well in my office, and I have a fee that's for laser only, or it's a discounted fee because they're not getting adjusted, as long as they're under a regular chiropractic schedule. Then there's my patients that start out brand new. They get introduced to the laser, and they get laser therapy for their lower and upper cross syndromes to help heal the process on a 3 times a week program. So one of the things we do to assist these processes of healing is biomechanical assistance. To get the joints moving, to reactivate and break the cycles, you get into cats and dogs. Those are the exercise left. Those are prime stabilizer movers all in sequence, and they relearn the patterns of the body. On the right, flying Supermans. You opposite arm, opposite leg. That's the X factor. That is fine. Now, here's a good thing. Take some of your patients, put them face down on the table the next time you see them. Say, can you lift your left, keep your leg straight and raise your left leg straight up in the air for me? They might be able to do that well. Raise your right leg. They might not be able to lift it as high, or they might hike their hip and turn. Okay, let's see that you find that pattern. Take their left arm, if it's a right leg problem, tell them to reach out straight in front of them. Say, lift your left arm up, and now put your hand on their low back, and then say, raise your right leg again. And most often they'll get 20 to 50% stronger, if not all the way. You just found a stability motor control pattern. You go do that 3 times. 1, 2, 3. Get in there, loosen it up, adjust them. You've created a new pattern. You've connected the dots like an electrician, and you've restabilized the joint. At that point in time, I do laser therapy in that area to fire the neurons, to decrease any inflammation that was coming from that pattern, and it's putting that healing on Red Bull. That's where you change patterns. So that's the person in the lower left corner where I'm doing that test. There, and you do your active release when you do the person's lying face down. Just put the thumb right on the piriformis. That's the ones when they go, oh, that's the brutal pain. And you strip the fascia and you do the internal external rotation to get it loose. Nothing frees a lumbar spine easier than if you do that a few times before you adjust. But if you want to get that glute firing so that they can do those overhead deep squats and the other tests, picture Jordan Spieth, Masters champion this year, big Titleist Performance Institute and chiropractic advocate, doing mini band side steps. That is something they do at home to help them hold their adjustments longer. They get involved in that. You give them mini bands for $3 and you take them home and get them firing those, guess what happens? They end up thinking about you because every time they look at the mini band, that's like a calling card. They go, I got to get adjusted. Now, one of the things I did get a question before the seminar started about what happens if you find a person who has a functional normal pattern or a functional painful pattern. And it's very important to understand, well, what we're looking at here. When would you use laser? When would you not? Essentially, when you have a dysfunctional pattern, if you have inflammation or lack of mobility or tension extensibility issues, we would use laser. We would use the appropriate fix. We'd use the hands-on chiropractic care, but we would use laser therapy to help stimulate the action and the nerve pathway there. So even if it is non-painful, laser is the only modality without any side effects. Now, to be clear, and as a disclaimer here, you never put laser over a cancerous tumor or over a gland. That's a given. That's part of the safety checks we have in place. But outside of that, it's light energy. And so using that to advance your healing, if you've got somebody who want to speed up the pattern, you want to get blood flow to the muscle so that it can learn how to function better or restore function or inflammation reduction. There's people that can have inflammation without pain. So you could use it in that instance. I have a lot of patients that come into my office regularly who don't have any symptoms, but they say, I want to get my regular adjustment, but this is my problem, Eric. Can I keep getting laser therapy as well? And I go, absolutely. Why would you say no in that instance? It's a health promoter. 2 of the more common problems you're going to see in the office. Biomechanics wise, rotator cuff problems. You see this all the time. These are the people that leave your office to go get therapy because they didn't think a chiropractor could help. And piriformis syndrome, or again, these are the 2 areas you see with lower and upper cross syndrome. Active release, doing some stripping of the posterior capsule in the rotator cuff and in the hip joint. loosening up the gluteal fascia, and using laser therapy in there passively before you give them strengthening exercises, lasering the 3 spots that you can see on the one top right rotator cuff, and then you'd laser the L5 disc right over the piriformis and right across the glute. That would give you all of the proper areas to get doing there. So what happens is, if you have these symptoms, you have to treat them enough. So what's a common treatment protocol for somebody who comes in with a shoulder? Well, shoulders, lumbar spines, disc, piriformis, lower and upper cross syndromes will typically need 3 times a week chiropractic care and laser for 4 to 6 weeks, coupled with home exercise programs to change the pattern of dysfunction. So if you make your care affordable, you explain the need why, and they can get into the habit of coming into your office. And once they see the results, if they come 3 or 4 times, they might get a little bit better, but they're not the ones who are going to get the results all the way. The problem's going to come back. So you'll have people that said, well, laser therapy at other offices was going to cost me $80 a session. I'd be out of benefits in 3. You know, we charge a $10 surcharge for laser on top of my adjustment fee so that they can get on it. And when they're only laser only, I think we charge them $25 for 3 to 6 minutes of laser, so it's always in use. We want them in the habit of coming to our office. We want them to be affordable care so they can get the number of visits they need, and then they're going to refer others. Here is an example on the left of me doing a scapular mobilization. Now this is I do before I adjust the thoracic spine. If you can get the scapula to start gliding, you can remove impingements. If you've got an upper crossed person, the scapula stops moving properly. So you have to get that scapula moving properly and thereby getting the shoulder moving. On the right, you're seeing me doing a mulligan mobilization, where we take the shoulder, we gently move it up into that degree, we traction down towards the hip, and then down to the floor very gently, and then very gentle rocking motions to move the shoulder through its joint. This is where you break your frozen shoulders. Once you get that little bit of motion in there, lots of laser, lots of icing. And then this is a stability exercise. You can Google it, called Why Me's, where you bring your arms up to 45 degrees, turn back, and try to put a tennis ball between your shoulders, squeezing down and in. That's re-encouraging the pattern for your upper crossed people to learn how to hold their shoulder blades in place. Foam rolling. Breaking down, remember, stiffer fibrotic spine decreases mechanoreceptor firing. So foam rolling out between visits help patients hold their adjustments. So how about laser? How's laser going to help us in these areas? You can see that we're lasering a neck, a shoulder, and a low back. Laser breaks the pain inhibition patterns by decreasing inflammation. This allows the doctor to restore function in a program of care, healing the problem versus covering. Laser goes through the tissue, stimulates neovascularization or proper blood flow, decreasing inflammation. It can help change the inflammation levels, help stimulate collagen production and nerve regeneration. Now, not all lasers are equal. Super pulse laser therapy are the only ones that activate the other pathways. There's lasers out there that you have to wrap on the person and leave them on there for 20 or 30 minutes just to deliver the dose. That's delivering the 660 ATP pathway, where it will stimulate some extra energy in the cells. But if you're going to hit the nitric oxide pathway and reduce inflammation and hit the nervous system pathway at the 905, that's where a super pulse technology that can get into the tissues has to be used. The other technologies will not activate those pathways. The beauty of super pulse laser is that I can do a spot for 3 minutes and deliver, the most amazing amounts of energy into those tissues without any side effects or creating heat. The Journal of Anesthesiology said that nitric oxide is mainly a neuromodulator of the brain. Its signaling appears to be essential for neuroplasticity. That is huge. Nitric oxide in the bottom bullet possesses protective and destructive duality inherent in every other component of the immune response. This exerts beneficial effects by acting as antibacterial, antiparasitic, antiviral for the body. By delivering all natural, healthy superpulse laser therapy in conjunction with your chiropractic adjustments, you're actually helping their immune system, which is pretty cool. So a chiropractor, who is a go-to person, provides world-class chiropractic care and can also offer laser therapy for problems that they're leaving your office for, that helps with migraines, tendonitis, arthritis, tennis elbow, intercostal pain, hip bursitis, wounds, knee pain, knee arthritis, plantar fasciitis. I used to have patients leave my office and get orthotics from other people and do physio and all these other things for plantar fasciitis. It used to drive me nuts because they'd be spending all their money there and not getting their regular care. My success rate with using a golf ball and rolling it and icing it was about 50%. As soon as we got laser therapy in the office, the super pulse Theralase laser, my success rate went up to about 95%. 6 to 7 treatments, people already started feeling better when we lasered just just under the heel and along that plantar fascia. The results have been amazing. What an amazing tool you can offer your patients. This is a picture of my patient getting laser on his knee. He's a regular once a weeker, comes in, he's got chronic arthritis in his knees. He used to walk with a cane. He doesn't walk with a cane anymore. Long story short, he says, can I keep coming every week? I want to be a lifer. That's a pretty cool patient. He himself referred 5 patients to us that are under regular chiropractic care. These are the kind of patients that you're trying to create by becoming a go-to chiropractor. Again, pricing people into your office, that's the most important thing. I charge a $10 surcharge for laser so that people can afford to get on it. So we do about 4,800 laser treatments a year. At $10 a treatment, that's $48,000 in income. You don't have to price your people out of the market. Now, that $10 surcharge is on top of my $37 laser fee for most visits. So we're doing about, patients getting adjusted with laser, about $225,000 a year in income. I also have patients that aren't on the laser at all times. Most people that haven't been on it will say once in a while when they're under regular care, they get a problem, they bang their foot, they trip, they have a fall shoveling snow, they got a few bruises, they go, can I get a few laser sessions? We go, absolutely. They'll get more adjustments with laser when they're coming in. And for my laser only patients, we charge them $25. I've got a patient who comes in Monday, Thursday, Wednesday. He comes in Monday, Thursday, Wednesday for the last 5 years to get laser on his knees so he can keep being a framer because he can't take Celebrex because he had a stomach blowout from that side effect of that drug. There's a picture of my office. When you walk in the door, you see a laser poster on the door. Every patient who walks in sees that, so they know that laser's going on in that room. Marketing wise, they go, hey, what's going on in that room? How come I got to go in that room? I want to go in there and get that room adjusted. And you see the table with the thing there. Just another thing, world-class athletes are using Theralase laser products, the super pulse laser. Tulowitzki, who just had his shoulder blade cracked before the playoffs in the World Series, ALCS Championship, he was back in 3 weeks. That didn't happen by coincidence. George Poulis, trainer of the Blue Jays, the Theralase is the most effective technology we've ever used. Using your website, putting some information on there, that's important so that people can see the different things that you do and they can go to your website and see. I've got more referrals just by having this little blurb, which we can help get anybody set up with on that, because you Google it, all these things come up on Google for your site. I don't pay for search engine optimization or anything like that. This just comes up. People come in and go, I want to try laser. So I know we've gone over a lot of stuff and we've got a few minutes to answer some questions if anybody's got any questions, but in the spirit of not leaving anybody hanging, I'm available for some consulting or very simple questions. You can go to my website, look it up. You can go to my email address and email me questions. It's not Simpatio, it's actually Simpatico. I've got to change that. You can contact Theralase and get in touch with us. They've got an amazing support team. So this is just a snippet of what's out there. Theralase down the road is looking to create a full-day seminar that teaches more and more in-depth of getting your hands on and some of these things, so keep an eye for that. It's a company that offers amazing progressive continuing education things, of which I'm thrilled to be a part of helping them develop.